I'm looking forward to sharing a virtual message from Dr. Debra Houry, Chief Medical Officer and Deputy Director for Program and Science at CDC. Dr. Houry is responsible for establishing, strengthening, and maintaining collaboration and coordination across CDC's national centers. Her work is vital in ensuring prevention is at the center of strategies to address sexual violence. Would you all please join me in watching Dr. Houry's virtual address?
Good morning. It's a pleasure to be joining you from CDC. I'm Dr. Deb Houry, CDC's Deputy Director for Program and Science and the agency's Chief Medical Officer. I am delighted to be here virtually to welcome you to the 2023 National Sexual Assault Conference. This year's theme, Equity in Action, highlights the importance of ensuring health equity for all and is a key critical component of sexual violence prevention work happening across the country. When everyone has a fair and just opportunity to be as healthy as possible, this is health equity. And to achieve this, we must value every person and their health fairly, address unfair practices and unjust conditions that can harm the health of specific groups in society, and work with people in specific, sensitive ways to address the health issues that affect them personally. With you, our partners, our colleagues, we must change the systems and policies that have resulted in the generational injustices. At CDC, our priority is to lead in this effort from the inside out, from the work we do internally as an organization to the work we do externally on behalf of the nation's health and safety. We have heard from those of you doing the work on the ground in communities, including our CDC Rape Prevention and Education Program recipients and other partners, about the barriers you face in prioritizing populations most at risk for sexual violence. But we have also heard about your innovations and successes despite the challenges you face. For example, to reduce the prevalence of sexual violence among students, Illinois' RPE program reviewed data from the 2019 Youth Risk Behavior Survey and found that 12% of girls and 7.5% of boys reported they had been physically forced to have sexual intercourse in grades 9 through 12. In response, the program provided comprehensive sex education focusing on consent, which can prevent sexual violence among youth. I hope this conference inspires you to engage in further dialogue, to share and learn from each other about how to navigate these challenges as champions for sexual violence prevention. Ending sexual violence requires transformation at all levels, from the individual to our communities. CDC is investing over $40 million annually to build state and local capacity to do this transformative work through the Rape Prevention and Education, or RPE program. RPE supports state and territorial health departments and their partners, such as state sexual assault coalitions, to implement prevention strategies that meet the needs of communities and move us towards a society free of sexual violence. Gender-based violence prevention partners across our nation, many of you in this room, work together to help reauthorize the Violence Against Women Act of 2022, which allows CDC to allocate a portion of RPE funding to state, territorial, and tribal sexual assault coalitions. This is a welcome opportunity, and earlier this year, CDC was thrilled to release a notice of funding opportunity directly for these coalitions. As a result, for the first time, CDC is now providing direct funding to tribal sexual assault coalitions, which will expand sexual violence prevention work in Indian country. This is equity in action. And there are even more resources right here at CDC to assist all communities, not just CDC grantees. Working to prevent sexual violence such as Veto Violence, a unique suite of web-based tools, trainings, and communication materials for individuals and communities to prevent violence and implement evidence-based strategies. CDC has also published the Stop Sexual Violence Technical Package. now rebranded as a resource for action, to help communities and states prioritize primary prevention strategies based on the best available evidence to prevent sexual violence before it starts. I know many of our funded recipients and partners are in the audience today. I want to say thank you for your amazing work. Your efforts to end sexual violence inspire me every day. I know you will all be inspired by the speakers at this plenary session and throughout the conference. I encourage you to find ways to put that inspiration into action, regardless of your role, to prevent sexual violence. By working together at all levels and across sectors, I believe that one day we can be a society free of sexual violence. Thank you for the opportunity to welcome you today, and have a great conference.